right, so for the Achilles tendon transverse friction massage, what we're going to do is we're going to have the patient lying prone, relaxed with their arms at their side. We're also going to have the foot hanging slightly off the table, just so that we can take any tension off of the Achilles tendon that it would be under if it was if the patient's foot was on the table and they were stuck in full plantar flexion. All right. So this treatment's going to be indicated for a tendonitis or a tendinopathy of the Achilles tendon. And you're going to do it to reduce any pain or edema in the tissue. To do the actual treatment, what you're going to do is first you're going to find the most painful point of the tendon, and usually that's going to be 2 to 4 centimeters superior to its insertion. So we're going to find the insertion of the Achilles at the calcaneal tuberosity. Go up 2 to 4 centimeters, and we're going to assume we found a tender spot about 3 centimeters above the insertion. So what we're going to do is we're just going to pinch the two sides of the Achilles tendon with our right hand using our thumb and index finger pads. We're going to pinch it and just raise up. Pinch and raise. Pinch and raise. Now, since this is already a painful spot to palpate on the patient due to their tendon dysfunction, we should be monitoring the patient for any reactions, any possible muscle guarding they might have from a pain reaction. As far as dosage goes for this treatment, it's going to be dependent on what you're going for. So about a minute and a half to 2 minutes will help you to activate descending inhibition with the gate control theory of pain, and that'll help relieve the patient's pain so that you can do some of your exercises or range of motion, or just relieve the patient's pain. Indications for progression would be the patient no longer has that tender point. And as far as progressing to active range of motions, or depending on what stage the tendinopathy is in, will help you determine whether you should progress to just active range of motion, or maybe something like heel raises. But both would be excellent options for progressing treatment for a Achilles tendon transverse friction massage.